with the family? What nursing actions, family nursing actions, did you see to try to make that connection happen?
I think the biggest thing that I started off right from the get-go was introducing myself and shaking his wife's hand, and then the patient's, and also introducing, the student that was working with me. And Emily, as a student, did a good job as communicating, the family's, wife's name on the whiteboard and her number, and kind of starting off that we want the family member involved in the care.
Okay, so the idea of introductions seemed to be a priority. The idea of being able to have contact information from the family and know who's who and be able to introduce yourself to begin that relationship. Okay, what else did you see in terms of you, or what else did you see as you were in the room?
I saw like we as nurses use the wife as a resource. Like we included her with the care as well, but looked to her for history of her husband's condition and just kind of got her involved that way. I think that gave us more information that we could have used, so it's good.
So the wife you saw as the information keeper in the family.
Right.
She had tracked what the past history looked like. She knew this was not normal from the past, and so she was able to give you that information. That was helpful. Okay. What else did you see in relationship to what?
Michelle did a really good job in explaining everything she was doing the whole time and trying to decrease Amber's anxiety and just letting her know, like, we're doing this to help this, and this is why we're doing it. Just always explaining and communicating with her.
Okay. So what you're telling me is there was an ongoing exchange of information. That's what I hear you saying. So it wasn't just a one-time give the family this pamphlet or this piece of information or statement. It was an ongoing dialogue. Okay? I think that is important to do, and I think you really did a nice job with that. What else did you think in terms of you?
I think for me, my biggest thing is I want to be down to the family member's level. Get down. If they're sitting in a chair, kneel down, pull up a chair next to them, and also using that touch. Putting a hand on her shoulder or letting her know that I'm there, I'm listening, you have my attention, and also inviting her up to next to the bedside as a way to decrease her anxiety is to be present with her husband, letting him know that she's there and that she's there helping.
So what I hear you saying, I keep reflecting back to you, but this is what I hear. I hear you saying you invited the family member into the experience that the patient was having. You invited them to partner with you, and you brought them and gave them a purpose. Brought her closer, told her where to sit. Gave her instructions on what she could do along the way to facilitate what you were doing as a nurse. Okay, I agree. I agree that you did a really nice job with that. I also think you used your presence as a nurse to invite the family's presence. So you showed your presence by getting down on the knee, making good eye contact, demonstrating that idea of wanting to connect. And you as the wife, did you feel that?
I definitely felt that, and I felt a big thing was like what Michelle did with just putting her hand on my back and letting me know that she was there to answer questions, for support, for comfort. That really did make a huge difference in the overall experience.
So what I think you're talking about is presence from a family perspective. The family's presence was invited.
Yes.
The family felt the nurse was present for them.
Yes.
And so presence was a central construct of what it was you were doing related to simulation. Okay. Family construct that you would like to mention, and that you would like to tell me what data you saw and assessed in a family member related to that.
I noticed the wife going through family suffering, because I feel that her as the caregiver of her husband, she kind of felt helpless in a way, and having like Michelle, like everyone involving her in the care really helped support that, so she did feel like she had made a difference and she was important and needed in the situation.
So when you say suffering and you think of the family member suffering, what are the ways in which you think that family member suffers with the patient?
I felt that there was a role change, that I went from being, a man's wife to a man's caregiver, protector, advocate, and just felt a whole different shift of a normal perception. Life as you know it kind of gets turned upside down, and you're in a strange place with strange people, and you don't know what all those beeps are and all those numbers. But I felt that the nurses that I had in this situation really did a comprehensive view of explaining things and bringing down those high anxiety levels that occur with any unknown situation.
So when I think of family suffering and I think of you trying to alleviate that, you couldn't take it away from her, but you could listen to her, which is what I heard you saying that you felt, and that was helpful to you.
Absolutely.
And giving you some sense of purpose
Mm-hmm.
was helpful, so that you didn't feel as loss of power, loss of control in the situation. Is that right?
Or yes, and another thing that I thought of was like I didn't feel isolated. I didn't feel like my husband, my loved one, was just a thing or an assessment. I really felt that he was he was being viewed and treated as a whole person, and that I was being thoroughly included in that as well. So, because there's a lot of second guessing in those kind of situations. Did I do the right thing? What could I have changed? Would the outcome have been different?
And see, what I hear you describing there is the concept of anxiety. There's there's a threat. Anxiety happens when there's a threat. And so I think what you were saying is you saw ways in which all of you were trying to minimize some of the threat of the environment, threat of the situation, threat of the machinery, all of that. You've really hit on some key ideas of presence, communication, family concepts like uncertainty and anxiety and suffering, and you have commented on those and ways in which the nursing interventions tried to allay and work with some of those areas of concern. The one other question I want to ask has to do with if she had not been the nurse that she was a very family-centered nurse, family-focused nurse. She was attending to the family. What do you think might have happened if you had not been quite family-focused the way you were?
I don't think we would have had the outcome and that trusting relationship with that family member. You know, if we would have went in there and, you know, did our assessment, called the doctor and said, okay, we're going to the ICU, you know, that would have been very scary. And then, you know, that relationship for future nurses and physicians of that whole team would change drastically. You know, they wouldn't be trusting, it would be more of a combative arrangement and work instead of a collaborative work.
What would have happened with you if she had not been the kind of nurse she was?
I think in my case it would have been my anxiety would have skyrocketed. The family suffering would have really increased, because that kind of goes with not feeling like anyone cares, not feeling included, not feeling like your loved one is getting the optimal care that they're supposed to or you think that they're going to get. I think all of those things really would have been heightened if she wouldn't have been so caring and included me.
And one of the factors that contribute to uncertainty is feeling a lack of support. And so if she had not supported her the way you did, you would have felt more uncertain. And with more uncertainty, you would have possibly not trusted the environment as well. The other comment go ahead.
I just say, I think the patient would also suffer more, not acknowledging the family member, because we worried about each other. You both love each other, so I'm sure that would make the patient's status possibly worsen too if your anxiety escalates.
Because the patient and you know, the patient's in a new situation too. It's not just the family. The patient, you know, is probably going to be scared and have some anxiety, and that those loved ones are what brings them back down and keeps them centered and keeps them focused on getting better.
And you're absolutely right about there's research that supports the idea of the health of the family members and the health of the patient are related. And so as we can work with the family member, we improve the outcomes related to the patient also. Okay, I have one last question. It has to do with when you reflect on you participating in this simulation, what are you going to walk away from today?
I think maybe just understanding the importance of having family members there for our patients. You know, sometimes you'll see many patients that don't have family or loved ones, and they may need, you know, some additional resources that we can provide. We can supply them with the resources they need to get the support that they need, because it really can make all the difference in their outcomes.
I think taking away from today that this is the type of nurse that I want to be. You know, as I'm going to be graduating, I enjoy having family-centered care. I enjoy making those relationships and connecting with a family member and learning about how to care for their loved one and caring for the patient. You know, allowing them to know that I'm there for their family too kind of helps us all work together. And that's just the nurse that I want to be, what I've learned in school, and what I want to continue to do as I start my career.
And I think to add to that, just running through these scenarios really increases your confidence of how you want to act with family and like the type of nurse you want to portray to them.
So when we use the word individual family nurse partnership, you understand what that means, and
Yeah.
that's what you're asking to continue to do.
Mm-hmm.
I am quite sure you will continue to do that.
Thank you.
Yes, thank you.